The exchange doesn't impact. What it does, the one thing about, it's going to be interesting how insurance companies play out all these benefits and rules. Because insurances, on the one hand, have to meet a minimum essential health benefit package, which is more expansive than most individual health insurance plans. But for people in this room, the rate difference between a young person and an old person used to be the old person could get charged 5 times as much. The 60-year-old got charged 5 times as much as a 25-year-old. Now the 60-year-old can only get charged 3 times as much as the 25-year-old. So the rate band shrinks a little bit. So people.
That's why all the insurance companies, Medicare supplemental insurances, all took a huge jump this year.
I think they may have been trying to prime the pump and try to cover their expectations, but it's a new world. It's a new world for insurance companies too. Nobody knows for sure. Everyone's afraid that with the insurance exchange, obviously those folks who need care the most are going to be the first ones to try to sign on. That happens, so those tend to be more costly. So the challenge of the exchange is to get everybody in, including the younger, healthier folks, so that it keeps the premiums from going crazy. Yes?
I think when you were introduced, they said you were the interim director. Is that right?
Interim chair.
Interim chair. Chair of the Health Insurance Exchange.
What does that mean? Does that mean you might not
Somebody in the chair of the committee
with us
he was elected.
on this committee that long? Or, I mean, I'd hate to see you go.
I was appointed by the governor to be the interim chair. I'm still not quite sure what interim means. Neither does my wife. My understanding at this point was that the governor's office wanted to give the full board, which is meeting next Monday and Tuesday, the ability to affirm the appointment. So my hunch is the interim that title probably will slide. Yes? Good.
What's it going to take to get the Medicaid expansion in place sooner rather than later?
What it will take is a lot of information with a lot of folks like you, a lot of discussion with the legislators, a lot of work around trying to figure out building a constituency similar to what happened with the health insurance exchange to get the votes. Representative Fred Wood is from Burley. Fred was on the Medicaid expansion work group. He is supportive of this. So there's some key legislators already that are supportive. It's a matter of, first off, everybody wanted a breath after the legislators got done. So you give people about a month to get their breath. And then there's going to be a whole political action process that has to happen over the course of this year to build the momentum to create the dynamic to get it passed as early as possible next year.
What would be very useful, I think, with the citizens group trying to educate their respective legislators would be to get a state divided by legislative districts and get all of the economic breakout on what the impact on that legislative district's going to be, and also, of course, on the county basis, and in terms of whatever the charity savings might be to hospitals as well.
Try to put together the argument so if you could take the hospital in St. Mary's, you could say, in the county, here's your savings to the county, here's your savings in charity care, here's the economic impact that we think would come to you.
So when you're talking to an individual legislator, a constituent, you've got that very specific information on what the impact of Medicaid expansion will be in that particular district with his or his constituents.
And then what do you do with District 14?
Which is?
Well, DeMorda, all the guys.
Well, I'll tell you, you know what? You only need 50% plus 1. So realistically what you do is you figure out one by one, where you've got to, and you sort of know there's going to be some no votes no matter what. So in some cases, you try to work, and you use some legislators that are supportive to start with to try to figure out where do you build a base of support and how do you get it over the top. To be honest with you, there's a greater chance right now with the current Speaker of the House than with the past Speaker of the House.
That's true.
And so you've got, so I've got one more over there and then over here.
Well, I'm just, listening to all the testimonies during the session this time. You've got people that are on disabled people who have had their benefits cut by Medicaid over the years for budget sake. There's certain services that have been cut to where the point where they don't have a driver, they don't have, all of this. And the idea of Medicaid expansion would have possibly brought back some of those services. Is that the assumption we should make, is that if Medicaid expansion is passed, can those disabled persons expect to get their services back that have been cut over these years?
I'd like to say yes, but I think the answer is going to be no. Because the folks that are on Medicaid now have a certain benefit structure. The expansion really is talking about getting coverage to people who have none at all. New covered. Now
It won't necessarily allow renewal of services that have been lost. Is that what you're saying?
I think that's correct, because the renewing services that were lost, if the person's already on, they're not considered a new eligible, so they wouldn't qualify for the 100% federal funding. So the state would have to look at other ways to deal with that. Now, it's interesting to me that in this whole gun control, gun debate, both parties are talking about the need for better mental health funding, but I've yet to see an appropriation that would be able to do that. And so it get all, so there's a question.
Okay. Well, all right. How important is it, if I can talk, how important is it to have doctors in your community support this? Because my daughter is disabled, and we see a couple different doctors because of her conditions. And some of them are very, very unhappy about, the Affordable Care Act and what they think, that what they are assuming how it's going to affect them. And so I was thinking, if we can somehow convince the doctors to support the expansion, would that help push this further?
It certainly wouldn't hurt, but I wouldn't make this rise or fall on the physician community.
Well, no, I just wondered if it would,
Every physician you get on board helps.
Yeah, okay,
I guess that's the best way to say it.
all right, yeah.
Yes.
My question is this information that you've given us tonight on the website so that we can get it and give it to other people?
My presentation isn't on a website. Some of the stuff that I took from is on a couple different websites. I'll try to get that information to you.
Oh, good.
Steve.
Yes.
I believe we have a man at the back of the room videotaping the entire presentation, and it is possible to purchase,
A DVD.
I believe, a DVD from our local access channel. So that would be a way.
This is being videotaped. The slides will be available. There's a form to request information, so there's a way, if you want information, I can try to put some stuff together for you.
I do too.
Okay.
We'll do that.
Yes.
Do you know of any activity already of people who are going to be the leadership to get this thing going? It's got to get organized.
There's a website. So who's doing this? There's a website called Right Medicine for Idaho. Right Medicine for Idaho. I think it's probably .org. And that has a group. It's the Hospital Association, the Primary Care Association, the Boise Metro Chamber of Commerce, I think the Pocatello Chamber of Commerce, Academy of Family Physicians. There's a group that started to form around working on this year. It's called Right Medicine for Idaho.
There is
The right.
another group, which I represent, Idaho AARP.
Idaho AARP.
RP, major health educational activity with our 170,000 members in this state, working closely with the governor, your committee, and will be supporting the expansion of Medicaid this year.
So Idaho AARP will be another resource to work around Medicaid expansion, people getting insurance coverage, and they'll be working on a statewide basis. Yes? And the League of Women Voters.
In your very considered opinion, what do you think the odds are in the 2014 legislature that this will pass?
Can you repeat the question?
So what are the odds in 2014 that this will pass? Well, I believe that there is a very good chance to get this if, number one, we can get a benefit design that works philosophically, engages patients where possible, has a different payment model. So if we can get that design in place and people can get educated about the benefits, the economic impact of doing this. There were some legislators who said toward the very end of the session that it could possibly have passed this year, but people were just too tired. So I think it has a whole, when you look at the economic impact, that's what sells. And this thing has a very strong positive economic impact to do the right thing.
There is one other major factor, the fact that Representative Loescher, one of the most arch conservatives in the legislature, coming out with 2 bills at the end of the session supporting the expansion. There are other conservatives out there that probably respond more to the positive fiscal impact.
Yeah.
And this is good news, I think.
Yeah, so the comment was Representative Lurcher from Bone is in the very conservative camp, and he was the one that presented the legislation. He's the one that said, let's move forward. He was a county commissioner. He understands the financial impact, and it's huge. It's huge to the counties. And the bill that Representative Lurcher introduced would essentially eliminate the mill levy tax that went for county medical indigencies. So his introduction would give every county property tax owner a tax break. So this has a combination of a tax break and good health policy.
Should help Auto-Owners Project 60 too.
Yeah. Yes. Other questions?
On the insurance exchange, I'm wondering if it will be user-friendly and if people will know about it and what they need to do to participate.
On the user exchange, will it be user-friendly and will people know what to do and how to use it? I sure hope so. Number one, it is required. One of the requirements is to be user-friendly. Number two, there are systems in place to have folks available to help people figure out how to do it. We've sort of seen what the Sheba folks have done for Medicare. So the truth of the matter is there will need to be assistance given to a lot of people. And so the insurance exchange is supposed to have a simple application, streamlined, in languages at a reading level and languages that people understand. You're supposed to be able to apply online on the web, by phone, in person, by mail. So it is supposed to be designed so that it does work for people, and if they have someone, whether an insurance agent can do it, or a quote navigator, or someone working in a hospital could help out, anybody can help a person say, here's how to get through here to sort out what you might qualify in terms of a tax credit, which will help you decide which kind of plan you want with what kind of premium and copay and deductibles, but there will be help for people to sort through that.
we need to thank this man for his